Hello everyone and welcome back to my channel. This is Professor Asif Qureshi and you are watching Dr. Asif Lectures. Today we are starting a series for covering gynecology by 10 teachers, and this is going to be a day a chapter type of series. We will finish 17 chapters in hopefully 17 days. So that is a book which is highly recommended for gynecology preparation and काफ़ी सारे medical colleges में across the world ये book follow की जाती है. So let's begin with chapter number 1 which is going to be today's topic. और पूरी वीडियो में हम chapter 1 finish करेंगे, right? और chapter 1 है क्या? This is about the development and anatomy of the female sexual organs as well as the pelvis. So it will be a very good recap of all the embryology and anatomy which is important for understanding gynecology. अब जाहिर सी बात है, अगर आप सोचें ना इसको, तो अगर आपको reproductive organs and the pelvic area, if you understand the anatomy and the development, then only you can understand कि उससे associated diseases क्या है. मैं हमेशा स्टूडेंट्स को बात समझाता हूँ कि मेडिसिन इज ऑलवेज रिमेंबर्ड इन अ साइकिल ऑफ थिंग्स. यानी आपको पता होना चाहिए कि व्हाट इज नॉर्मल, देन व्हाट इज एबनॉर्मल विच इज पैथोलॉजी, एंड देन हाउ टू फिक्स इट विच इज देन आइदर मेडिसिन और सर्जरी. सो इट्स अ सिंपल कंटिन्यूअम ऑफ दिस साइकिल, राइट? सो आज का जो हमारा ये चैप्टर है, इट इज मोर फॉर एनाटमी एंड डेवलपमेंट. यहाँ एक मैं आपको और कनेक्टिव लिंक बता देता हूँ, बल्कि मैं लिंक डाल दूंगा इसी वीडियो में. आप ऊपर देखेंगे अपनी स्क्रीन के टॉप राइट पे, तो यू विल सी मेरे जो एनाटमी के लेक्चर हैं पेल्विस के और फीमेल रिप्रोडक्टिव ऑर्गन्स के, ऑल्सो डेवलपमेंट के जो लेक्चर्स हैं एम्ब्रियोलॉजी के फ्रॉम लैंगमैन, उनके मैं लिंक से दे रहा हूँ. यहाँ आपको ऊपर टॉप पे नजर आ जाएंगे, यू कैन सी देम हियर. और उन वीडियोस को भी चाहें तो आप देख सकते हैं. बट लेट अस बिगिन फ्रॉम 10 टीचर्स, क्योंकि 10 टीचर्स ने बहुत ही फोकस्ड एनाटमी और एम्ब्रियोलॉजी बताई है विच इज पर्टेनिंग टू देयर अपकमिंग चैप्टर्स. यानी आगे जो चैप्टर 1 के बाद चैप्टर्स आने हैं फर्दर, उसमें जो डिस्कशन इन्होंने करने हैं वो सारी एनाटमी इन्होंने इस चैप्टर में बता रखी है. सो लेट्स बिगिन. एंड ऑब्वियसली 10 टीचर की एक बात मुझे अच्छी लगती है कि जब भी ये कोई चैप्टर स्टार्ट करता है, एट द वेरी आउटसाइड इट टेल्स यू व्हाट आर द लर्निंग ऑब्जेक्टिव्स. और यही एक मेडिकल एजुकेशन की बुक का और लेक्चर का स्टार्टिंग पॉइंट होना भी चाहिए कि व्हाट आर द ऑब्जेक्टिव्स. इस चैप्टर से आप एक्सपेक्ट क्या कर रहे हैं. सो इस चैप्टर के एंड पे यू शुड बी एबल टू अंडरस्टैंड व्हाट आर द सेक्सुअल डिफरेंशिएशन एंड डेवलपमेंट बिगिन हाउ अर्ली इन द लाइफ, इन द एम्ब्रियोनिक लाइफ. बिकॉज व्हेन द जाइगोट इज प्रोड्यूस, जाइगोट का कोई जेंडर नहीं होता, जाइगोट ना मेल होता है ना फीमेल होता है, इट्स जस्ट अ जाइगोट. बट वंस इट स्टार्ट्स डिफरेंशिएटिंग, it then differentiates into a male or a female baby. Now I know many students will say कि zygote का सर जेंडर कैसे नहीं होता. ये तो हमें पता ही होता ना कि zygote is going to be XX और XY. You are very right. हमें zygote बनने के स्टेज पे ये बात पता होती है कि if it is XX, it is going to be a female baby. और अगर zygote XY है तो it is going to be a male baby. What I meant is कि इसका कोई phenotypic gender इस वक्त नहीं होता, although इसका genotypic gender हमें पता होता है, right? और फिर डेवलपमेंटल टाइम फ्रेम के साथ साथ अगर XX है तो फीमेल डेवलप होनी चाहिए, और अगर XY है तो मेल डेवलप होना चाहिए. अगेन देखें, मैं जो ये कह रहा हूं होना चाहिए, उसका रीजन ये है बिकॉज वंस वी हैव अ जाइगोट फॉर्म्ड, राइट? अब सपोज जाइगोट का जेंडर है X और X, जीनोटिपिक जेंडर, लेकिन डेवलपमेंट के दौरान ये देयर आर सम एबनॉर्मैलिटीज, देयर आर सम जेनेटिक म्यूटेशंस कि एक फीमेल बेबी डेवलप नहीं हुआ. दिस इज द रीजन आई वाज सेइंग कि जाइगोट के स्टेज पे जेंडर आइडेंटिफाइड जीनोटिपिकली तो होता है, बट फिनोटिपिकली वी डोंट नो, वी हैव टू वेट एंड सी. तो आपको ये पता होगा इस चैप्टर के एंड तक कि किस स्टेज पर एम्ब्रियोलॉजी में जेंडर डिस्क्रिमिनेशन होती है. You should also be able to understand कि embryonic development और anatomy क्या है perineum की, and the female जो organs हैं including the vagina, cervix, uterus, adnexia and the ovary and their association with the bladder and ureter. So basically embryology पे हम बात करेंगे, anatomy पे हम बात करेंगे, and very important the blood supply. ये blood supply बहुत ज़्यादा important इसलिए है क्योंकि जब हम surgery related बात करेंगे, there are so many uterine cancers which are common, there are so many ovarian cancers which are common. तो जब उनके ऑपरेशंस, हिस्टेरेक्टमी, ओफेरेक्टमी, इनकी बात करेंगे तो वहाँ ये इंपॉर्टेंट है समझना कि कौन सी ब्लड सप्लाईज हैं इन ऑर्गन्स की, बिकॉज उनको भी फिर हमें कट करना है और उनकी पेरिफरीज और उनकी सारे आपको ट्रिब्यूटरीज पता होनी चाहिए, राइट? फिर लिम्फेटिक्स, बिकॉज कैंसर्स लिम्फेटिक्स के थ्रू स्प्रेड करते हैं. यू शुड नो व्हाट आर द लिम्फेटिक ड्रेनेज ऑफ दीज पेरिनियल ऑर्गन्स. यू शुड ऑल्सो बी एबल टू अंडरस्टैंड द इनर्वेशन ऑफ द पेल्विस एंड पेरिनियम, नर्व सप्लाई क्या है, एंड अंडरस्टैंड द वल्नरेबिलिटी ऑफ द सर्टेन structures in gynecological surgery. This is very important, high yield. चैप्टर नंबर लास्ट जब हम करेंगे, which is chapter number I think 17, उस वक्त we will be discussing कि what are the different surgical procedures. I think chapter 17 यही है सर्जरी वाला. बट एनीवेज इट्स टुवर्ड्स द एंड ऑफ द बुक, तो उस वक्त हम ये बात दोबारा करेंगे। देखें, बुक के स्टार्ट में हम ये बात कर रहे हैं कि व्हाट आर द वल्नरेबल स्ट्रक्चर। बात सारी ये है कि यूट्रस जो है इट इज डिजाइन इन अ वे, एंड देन द फेलोपियन ट्यूब्स एंड देन द ओवरीज, कि इनके सराउंडिंग में देयर आर वेरी इंपॉर्टेंट स्ट्रक्चर। सो यूट्रस फॉर एग्जांपल इज इन डायरेक्ट कॉन्टैक्ट, well, not exactly in direct contact, but in very close proximity with urinary bladder. So ये बहुत important point है। फिर इसी तरह ये जो fallopian tubes हैं, इनके important relation हैं, bowel के loops important relation में आते हैं यूट्रस के, and then there are a few ligaments, broad ligament है, उसमें से कुछ arteries गुजर रही हैं, फिर there are very important connections with the ureter which is coming from the kidney, फिर ये सारा जो इंपॉर्टेंट एनाटॉमिकल रिलेशनशिप है, दिस इज ऑल वेरी इंपॉर्टेंट टू अंडरस्टैंड। क्योंकि पता चले आप यूट्रस की सर्जरी करने जा रहे हैं, गलती से ये इधर गलत कट कर दिया, वो उधर गलत कट कर दिया, तो वेरी वेरी इंपॉर्टेंट टू अंडरस्टैंड कि वल्नरेबिलिटी क्या है। यानी जब आप गायनेकोलॉजिकल सर्जरी कर रहे हैं, सो व्हाट ऑर्गन्स नियर बाय आर वल्नरेबल फॉर डैमेज, इट्स अ वेरी इंपॉर्टेंट पॉइंट। एंड देन डिस्क्राइब द स्ट्रक्चरल एबनॉर्मैलिटीज रिजल्टिंग फ्रॉम मुलेरियन डक्ट डिसऑर्डर। दिस इज ऑल्सो वेरी कॉमन, क्योंकि जब डेवलपमेंट हो रही होती है तो ये जो मुलेरियन डक्ट के डिसऑर्डर्स हैं, ये एग्जाम में भी आते हैं या रियल लाइफ में बड़े इंपॉर्टेंट है। सो इट्स गोइंग टू बी अ वेरी रिच चैप्टर एक्चुअली, काफ़ी लंबी वीडियो बनने वाली है, बट बेयर विद मी, वी विल फिनिश इट इन वन गो होपफुली, एंड दीज आर द लर्निंग ऑब्जेक्टिव्स। सो अगर मैं लर्निंग ऑब्जेक्टिव्स को समराइज करूँ, सो बेसिकली हम एम्ब्रियोलॉजी की बात करेंगे, वी विल टॉक अबाउट एनाटॉमी इन डिटेल, एंड दैट इज इट। इसी पर है ये सारे डिफरेंट लर्निंग ऑब्जेक्टिव्स, ओके। So the first topic first, let's talk about the sexual differentiation of the fetus and development of sexual organs. So it says gonadal rudiments appear as genital ridge over the embryonic kidney. So basically जब zygote से development का process हो रहा होता है, the area where the kidneys are formed, there is a ridge which appears, and that ridge is called gonadal या genital ridge. It appears overlying the embryonic kidney in the intermediate mesoderm. So it arises from mesoderm. ये सारे अब इंपॉर्टेंट पॉइंट है जो मैं हाईलाइट कर रहा हूँ, राइट। और ये कब होता है ये इवेंट, जो जेनेटल रिज अपीयर होता है, इसे देखा जाता है ड्यूरिंग 4th वीक ऑफ एम्ब्रियोनिक लाइफ। तो ये टाइम पॉइंट भी इंपॉर्टेंट है। एंड दे रिमेन सेक्सुअली इनडिफरेंट अंटिल द 7th, यानी 4th वीक ऑफ डेवलपमेंट से 7th वीक ऑफ डेवलपमेंट तक आप फिनोटिपिकली ग्रॉस एनाटॉमी देख के बता नहीं सकते कि इज इट अ मेल बेबी और अ फीमेल बेबी। तो कोई दे आर सेक्सुअली इनडिफरेंट, यानी पता ही नहीं चलता, राइट। The undifferentiated gonad has the potential to become either a testis or an ovary. अब अगेन जीनोटाइप डिटरमिन करेगा। अगर XY जीनोटाइप है तो टेस्टिस ने डेवलप होना है, और अगर XX जीनोटाइप है तो ओवरी ने डेवलप होना है। बट दैट डेवलपमेंट इज नॉट ऑब्वियस एटलीस्ट अंटिल 7th वीक ऑफ डेवलपमेंट, ठीक है। तो इसीलिए ये जो गोनेड है, दिस इज कॉल्ड बायपोटेंशियल। बायपोटेंशियल का मतलब ये है कि ये टेस्टिस भी बना सकता है, ओवरी भी बना सकता है। एंड द क्रोमोसोमल कॉम्प्लीमेंट ऑफ द ज़ाइगोट डिटरमाइंस वेदर द गोनेड बिकम्स अ टेस्टिस और एन ओवरी। ये क्रोमोसोमल कॉम्प्लीमेंट का मतलब ये है, इफ इट is XY, it is going to be a testis. If it is XX, it is going to be an ovary and a female. Now, the development of either the testis or ovary is an active gene-directed process. So it is primarily dependent on the chromosomes, okay? In the male, the activity of SRY gene, and this SRY gene is located specifically on the Y chromosome. And you know that only the male zygote will have Y chromosome, right? So iski activity, SRY gene ki activity, causes the gonad to begin the development into a testis. So if Y chromosome is not there, testis does not develop. Simple. In the past, ovarian development was considered a default phenomena, लेकिन अब हमें पता है कि ऐसा नहीं है. Now the development has been linked to SRY. So if SRY is there, it triggers the formation of male gender, which means the formation of testis. Okay. Now listen to this very carefully. The fetus has two set of structures called Mullerian duct system and Wolffian duct system. So when the fetus is developing, it contains both these structures, the Mullerian duct and Wolffian. Actually, I'll show you in a diagram as well. So if you look at this, there are two ducts, you know, there's a Mullerian duct and a Wolffian duct. So start में this is what the baby has. But then depending upon के genotype क्या है, इनमें से एक डक्ट सिस्टम गायब हो जाता है और मेल सिस्टम डेवलप हो जाता है. सो फॉर एग्जांपल अगर टेस्टिस डेवलप होती हैं, विच मीन्स कि अगर XY जीन मौजूद है, तो व्हाट हैपेंस कि टेस्टिस में दो तरह के सेल्स होते हैं. वन ऑफ द टाइप ऑफ सेल रिलीज एंटाई मुलेरियन हार्मोन। वो एंटाई मुलेरियन हार्मोन ये करता है कि मुलेरियन डक्ट सिस्टम को खत्म कर देता है एंड ओनली द वॉल्फियन डक्ट सिस्टम रिमेन्स व्हिच देन डेवलप्स इनटू द मेल डक्ट सिस्टम। और फीमेल में इसका उल्टा हो जाता है कि मुलेरियन डक्ट सिस्टम परसिस्ट करता है बिकॉज देयर इज नो एएमएच, राइट। तो कहने का मकसद ये है कि यू मस्ट रिमेंबर कि दो तरह के डक्ट सिस्टम इनिशियली बनते हैं फीटस में, मुलेरियन डक्ट सिस्टम विच इज ऑल्सो कॉल्ड पैरामीसोनेफ्रिक डक्ट सिस्टम एंड द वॉल्फियन डक्ट सिस्टम which is also called the mesonephric duct system, and they have the potential to develop into the male and female structures respectively. तो ये भी थोड़ी देर में हम बात करेंगे भी इसके बारे में, but for now just remember please that the two duct system are initially both present. फिर अगर मेल जीनोटाइप होगा XY क्रोमोसोम तो एक जीन होगी SRY जीन, ये बनाएगी टेस्टिस की डेवलपमेंट। टेस्टिस से दो तरह के सेल्स जिनमें से एक प्रोड्यूस करेंगे एंटाई मुलेरियन। सो एंटाई मुलेरियन नाम से जाहिर है ये मुलेरियन को खत्म करेगा और वॉल्फियन परसिस्ट करेगा डेवलपिंग इनटू द मेल स्ट्रक्चर। एंड इफ दी जीनोटाइप फॉर एग्जांपल इज XX तो SRY जीन नहीं होगी, टेस्टिस डेवलप नहीं होंगे, एंटाई मुलेरियन हार्मोन नहीं होगा, सो मुलेरियन सिस्टम इज गोना डेवलप एंड परसिस्ट। सो दैट्स वेरी इंपॉर्टेंट फॉर यू टू अंडरस्टैंड। तो यहाँ तक ये देखें कितना छोटा सा पैराग्राफ है, और 10 टीचर्स की अच्छी बात यही है कि इट इज सच अ कॉन्साइज बुक बट इट कवर्स ऑलमोस्ट एवरीथिंग यू नीड टू नो। गायनेकोलॉजी में अगर ये आपने बुक पूरी पढ़ ली मेरे साथ देन यू आर गुड टू गो फॉर योर थर्ड ईयर्स, फोर्थ ईयर, इवन द क्लिनिकल ईयर्स एंड इवन द हाउस जॉब एंड देयर आफ्टर, बिकॉज दिस बुक देन कवर्स एवरीथिंग। सो द फर्स्ट पैराग्राफ डन एंड डस्टेड, यू नो कि कौन से वीक्स में डेवलपमेंट इनडिफरेंट है, कौन सा रीजन ऑफ द वाई क्रोमोसोम इज इंपॉर्टेंट फॉर ट्रिगरिंग द टेस्टिस फॉर्मेशन, कौन सी डक्ट्स मौजूद है। ओके, नाउ लेट्स स्टार्ट एंड फोकस ऑन हाउ द मेल स्ट्रक्चर्स आर फॉर्म्ड एंड देन वी विल टॉक अबाउट ऑब्वियसली हाउ द फीमेल स्ट्रक्चर, जो कि इस बुक का पूरा मेन थीसिस है गायनेकोलॉजी। Male organs की development as the gonads develop into a testis, it differentiates into two cell type। और ये क्यों होगा testis में development? If there is XY genetic makeup, Y पर कौन सी जीन मौजूद होती है SRY, and this SRY triggers testis formation. So it differentiates into two cell type. There is a cell type called Sertoli cells और ये अब testis में। So basically ये किडनी का रीजन है, इसके ऊपर ये genital bud डेवलप हुई है। अब अगर XY जीनोटाइप है सो Y क्रोमोसोम पर SRY जीन होगी और वो जीन टेस्टिस की डेवलपमेंट को ट्रिगर करेगी। तो जो जेनाइटल बड है इट विल स्टार्ट बिकमिंग टेस्टिस, और जब ये टेस्टिस बनना शुरू होंगे इट विल हैव टू टाइप ऑफ सेल्स। एक सेल्स का नाम है सर्टोली सेल एंड द अदर ग्रुप ऑफ सेल आर नोन एज लेरिक सेल्स, एंड बोथ दी सेल्स सीक्रेट समथिंग इंपॉर्टेंट। सो जो सर्टोली सेल्स हैं दे प्रोड्यूस anti-Mullerian hormone, a super important concept because ये जो कॉन्सेप्ट है भाई ये अगर आपने नहीं समझा तो बड़ा ही मसला होने वाला है। सो दे स्टार्ट रिलीजिंग एंटाई मुलेरियन हार्मोन AMH एंड द लैरिक सेल्स स्टार्ट प्रोड्यूसिंग टेस्टोस्टेरॉन। अब ये दोनों इंपॉर्टेंट कॉन्सेप्ट्स हैं। एंटाई मुलेरियन जो हार्मोन है इट सप्रेसेस फर्दर डेवलपमेंट ऑफ मुलेरियन डक्ट्स, whereas testosterone stimulates the Wolffian ducts to develop into the vas deferens, epididymis, and seminal vesicles. In addition, the external genitalia skin testosterone is converted by the enzyme 5-alpha reductase into dihydrotestosterone, which is even more potent chemical in terms of sexual development. This acts to viralize the external genitalia, and the genital tubercle becomes the penis, and the labioscrotal fold fuse to form the scrotum. So you see how the male genitals are being produced. The urogenital fold fuses along the ventral surface of the penis and enclose the urethra so that it opens the tip of the penis. So all this male structural development begins with the fact that there are XY chromosome, there is SRY gene, which begins the development of testis, and testis then develops two types of cells, Sertoli cells and Leydig cells, and the Sertoli and the Leydig cells secrete specific hormones. Sertoli cells से कौन सा chemical release हो रहा है? That is called AMH, anti-Mullerian, और Leydig cell से कौन सा hormone release हो रहा है? Testosterone, which both of them then starts shutting off the female structures and development of the male structures. Okay, and do not forget the formation of DHT, very important. Now, if we talk about the development of the female genitals, in the primitive ovary, the granulosa cells derived from the proliferative coelomic epithelium surround the germ cells and form the primordial follicles. अब ये ovary की बात हो रही है. So the genital tubercle है, it is now developing into the ovary, और उसमें there are different follicles. Each primordial follicle consists of an oocyte. Ovary के अंदर अगर हम इसको enlarge करके देखें, so there is a oocyte with a single layer of granulosa cells, and theca cells develop from proliferative coelomic epithelium and are separated from the granular cell by the basal lamina. So granulosa cell, then another layer of cells which is called the thecal cells, and center में oocyte मौजूद है. Okay, the maximum number of primordial follicles is reached at 20 weeks of gestation, and there are about 6 to 7 million primordial follicles. So इतने कम टाइम में, even when the baby is inside the body, just in 20 weeks, अभी embryonic life की बात हो रही है, 20 weeks embryonically, and they have 6 to 7 million of such follicles. So this is the storehouse that they have got, जो कि in the future life menstrual cycle में as an oocyte release होंगे. The number of these reduced by atresia, and at birth only 1 to 2 million remain, which is more than enough for the remaining menstrual cycle throughout the life. तो ये 6-7 तक पहुंचता है, 6-7 मिलियन, which means 60 से 70 लाख primary follicles, उनमें से फिर 1 से 2 मिलियन बचते हैं at birth. और ये throughout the life, the process of death of these follicle continues, and by the time the female reaches menarche, they have still they have 0.3 to 0.4 million, which means 3 से 4 लाख oocyte फिर भी होते हैं इनमें, and by menopause they have none, and this is why this is called menopause. All the oocytes, they have gone dead. Okay, the development of an oocyte within the primordial follicle is arrested in the prophase of its first meiotic division, and it remains until जब तक ovulation नहीं होती और फिर fertilization के बाद फिर ये process complete होता है, right? ये तो है बात हम अगले चैप्टर्स में समझेंगे, लेकिन अभी जो बात समझनी है वो ये कि डेवलपमेंट कैसे होती है फीमेल जेनाइटल्स की. इन द फीमेल्स, एब्सेंस ऑफ एएमएच. अब ये क्यों जुमला ये कह रहे हैं एब्सेंस ऑफ एएमएच? रीजन उसका ये है क्योंकि फीमेल्स में जाहिर है एक्स वाई क्रोमोसोम नहीं है, तो एस आर वाई जीन नहीं है, तो एएमएच नहीं प्रोड्यूस होगा. अब एएमएच नहीं प्रोड्यूस होता, इन द एब्सेंस ऑफ एएमएच व्हाट हैपेंस कि मुलेरियन डक्ट इनहिबिट होती ही नहीं है. अब जब मुलेरियन डक्ट्स इनहिबिट नहीं होती तो these structures start developing and female reproductive tract is developed, right? इन्हीं ducts से. The proximal two-third of the vagina is developed actually from the Mullerian ducts, which grow in a caudal direction, medial direction, and fuse in the midline. The midline fusion of these structure produces uterus, cervix, and upper vagina. So the point is that the Mullerian ducts start producing all these structures, right? And the cells proliferate from the upper portion of the urogenital sinus to form structures called the sinovaginal bulb. And the caudal extension of the Mullerian duct again projects into the posterior wall of the uterus and the tubercle. The Mullerian tubercles. अब ये सारी details इस तरह से कि posterolateral जा रहे हैं, posteromedial, this is not important. The point is that the Mullerian ducts, because they are not inhibited by AMH, develops into the female structures. Super important point. Okay. Right. Up ispe, we also need to see this diagram because this is technically an important one, and we must pay attention that how the genital ridge is produced. You see, this is the kidney, embryonic kidney, mesonephros, and then there is genital ridge. This genital ridge then have two type of ducts, Mullerian duct structures and Wolffian duct structures, and there is a gonad. अब ये सारा depend करता है कि अगर XY phenotype है तो ये जो gonad है, it will become testis, and they will produce AMH, and this will all be gone. और ये यहाँ इन्होंने बताया भी है. If you look at this diagram, so if there is AMH present, if there is testosterone present, DHT present, it becomes a male. The Mullerian ducts go away and these Wolffian ducts stay. Okay, so this is the male conversion. However, if there is only X and X genotype, so there is no SRY gene, what happens is that the Mullerian ducts stay, these gonads become ovary, and then the Wolffian ducts, they go away. Okay. and this then becomes a female structure. Right. So moving forward, the development of the external genitalia. The external genitalia do not viralize in the absence of testosterone. Now, why testosterone is not present in females? Because obviously there is no Leydig cell. There is no Sertoli cells भी नहीं है, तो AMH नहीं बन रहा. Leydig cells नहीं है, तो testosterone नहीं बन रहा. So there is no testosterone, so no viralization, no penis formation. Now, between the 5th and 7th week of life, the cloacal folds from the cloacal folds, which are pair of swelling adjacent to the cloacal membrane, fuse anteriorly, and they become the genital tubercle. This will then become the clitoris. Okay, so here the pattern of differentiation is from the cloacal structures. The perineum develops and divides the cloacal membrane into the anterior urinogenital membrane and the posterior anal membrane. So from the posterior structure, anus will develop the anal membranes, and from the anterior structure, the urinogenital membrane, all the external genitalia develop, which are the labia minoras, majoras, and labioscrotal fold. ये सारे जो external genitalia है, it develops from the cloacal fold initially, females में, और males में it is because of the viralization of testosterone, because of testosterone. So ये बड़ा यार important concept है, how things are developed. तो आपने इसमें जो key learning points है ना बॉस, वो ये याद रखने हैं कि the primitive gonad, which is phenotypically basically indifferent. अब वो देख के आप बता नहीं सकते कि ये मेल है फीमेल है. It is evident in 4 to 5 weeks पे होता है. और कहाँ होता है ये? नियर द किडनीज, mesonephric ridge के पास. The undifferentiated gonad has the potential to become either the testis or an ovary, depends upon कि genotype क्या है. If it is XY, it will become a testis. If it is XX, it will become an ovary. The paramesonephric duct, which later formed the Mullerian system, is the precursor of female genital development. And the lower end of the Mullerian duct fuses in the midline to form the uterus and the upper vagina. Most of the upper vagina is from the Mullerian origin, and the primordial follicles which form the oocytes, and we have discussed all these things. Okay, initially we have 6 to 7 million in the babies. At birth it is about 3 to 4 or 1 to 2 million, 2 to 4 million some people say, but then by the end of their by the beginning of their reproductive life, which is menarche, it becomes around like 3 to 4 lakhs. The maximum number of primordial follicle is reached at 20 weeks of gestation, which is 6 to 7 million, right? And they that reduce by the process of apoptosis, basically. All right. So next, your section start karna, that was all about the embryology, guys. And now we want to move forward with the anatomy. Let's now focus on the anatomy of the external genitalia. Obviously, we are now focusing only on females because this is the gynecology lecture series by 10 teachers. So the external genitalia are commonly called, cumulatively, they are also called vulva. And it involves mons pubis, labia majora, minora, vaginal vestibule, clitoris, greater vestibule. So these are all the external structures, right? So mons pubis is the fibro-fatty pad which is covered by hair-bearing skin. So if you remember my anatomy lectures from previously, so that ridge which is fibro-fatty, and we also call it the pubic hair area, this is what is known as the mons pubis. And then labia majora, these are two folds of skin which underlie the adipose tissue lying on the either side of the vaginal opening. So on either sides of the vaginal opening, these skin folds are known as labia majora. Inside them are labia minora. So they are basically composed of, they are skin tissues, but they contain fibro fatty type of inner core, and they also contain sebaceous glands and sweat glands, and also apocrine glands, which are very specialized, which produce specialized, secretions responsible for the smell in this particular region. In the deepest part of each labium is the core of fibro-fatty core अंदर मौजूद है, which is actually continuous with the inguinal canal. This is an important point, right? So these structures, the labia majoras, they are in connection with the inguinal canal and the fibers of the round ligament which terminate here. Another important point, because round ligament is very important in understanding gynecology. हम जब भी बात करेंगे surgery की, किसी operation की, any surgical procedure, we'll be talking about round ligament and the structures of round ligament. So remember, it is connected basically with labia majora. Okay, बहुत से students को ये concept नहीं होता. Now labia minora are two thin folds which are present actually between the labia majoras, और इनकी कोई इस तरह इंग्वाइनल कैनाल या लिगामेंट्स के साथ कनेक्शन नहीं है, बट दे आर important for a few points. So anteriorly you should know they divide into two to form prepuci and frenulum of the clitoris. So they contribute to the formation of the anterior part of the clitoris, also known as the clitoral hood. And posteriorly, they divide to form a fold of the skin, which is called fourchette, the back of the vagina. And this is the part which sometimes is actually torn during the process of delivery, and it has to be restitched, right? They contain sebaceous gland, but they do not have any adipose tissue, just like labia majora. Labia majora contains adipose tissues as well. They are not well developed before puberty, and they also atrophy after menopause. Both labia minora and majora become engorged during sexual activities, right? And erosion, particularly because of the blood supply. The clitoris is an erectile tissue. It's kind of very synonymous to the penis that the males have. It's an erectile tissue engorged with blood during arousal times. And this is a structure which is a small structure measuring 0.5 to 3.5 centimeter in length. So actually it can go up till the length of 3.5 centimeter, which is not quite a small structure, I would say. So some females may have big clitoris, for example. The body of the clitoris is the main part of the visible clitoris. So what you see is basically the body of the clitoris, and it is made up of paired column of erectile tissue. Now, erectile tissue, when we say, is basically vascular tissue. It's cavernous, which can be engorged and filled with the blood vessel, and the exact same mechanism as the penile erection we talk about. This is also the clitoral erection, and the erectile tissue present there is known as corpora cavernosa, which can be filled with the blood during sexual activities. Now, these become crura at the bottom of the clitoris. It's the same structure, if you recall, with the male penis, and the vestibule is the cleft between the labia minora. The vestibule is what leads to basically vagina. It contains openings of urethra, Bartholin gland, and vagina. So urethra also opens in the vestibule. This is the area from where women pee out. There are Bartholin glands, and if they are blocked, they can lead to infection there, which is not also uncommon. And the vagina is also basically initiating from the vestibule. The vagina is surrounded by two bulbs of erectile and vascular tissue, and they're extensive and almost completely over the distal vaginal wall, not an important line. These have traditionally been named as bulbal, though not important, right? Although recent work on both dissection and MRI suggests that they may be part of the clitoris, is also irrelevant, not important. The Bartholin gland are bilateral, दोनों तरफ होते हैं on the vestibule, and they're very small, actually not that small, size of a pea, that's a big one, and they open via the duct into the vestibule, below the hymen, and they contribute to the lubrication process during the intercourse exercise. So they're pretty important glands, Bartholin glands, right? They make the system wet and lubricate it during this sexual activity. The hymen is a thin covering of the mucous membrane, and this is present in the vestibule area across the vagina, and it is usually perforated, and this is important also because the menstrual blood has to come out of it during each menstrual cycle. The hymen is ruptured during the intercourse, and this is what we call the loss of virginity in simple terms. However, it must be very importantly understood that not all the females who do not have intact hymen, it does not simply implicate that they are basically not virgin. So it's not a direct indication, because hymen can be ruptured because of a lot of different things, such as extraneous exercise and a lot of other phenomena. So anyways, once the hymen is lost, the remains of the hymen, these are in the form of mucus tags, and they are known as carunculae multiforme. So it's a typical fancy name, and medicine is importantly recognized for having a lot of fancy names. So hymen, and then the remains of the hymen, even more difficult name, right? So that's about the external genitalia, the external structures. And then, so simple, you need to remember the mons pubis, the pubic hair area. Then there is a vestibule surrounded by labia minora first and the majora first. And then there is a clitoral structure, which is vascularly heavily supplied. Caverna corporosa are there. And then the vestibule has hymen, the glands, and also the start of vagina. So external genitalia ke baad, the next topic that we have to cover is is the internal reproductive organs. And the first one that we will talk about is vagina. And that's the way we will be proceeding. I think that's the sequence in the book, that there is vaginal discussion. Then after there, vagina का structure के बाद we'll talk about uterus, cervix भी आएगा, and then cervix, which is actually part of uterus, the lower part. So cervix, then uterus, and then the fallopian tubes, and then ovaries. So we'll talk about all of them. Let's start our discussion with the anatomy of vagina. So primarily, vagina is basically a fibromuscular canal which is lined with stratified squamous epithelium. And you should know this because this is important. It's a canal which leads into the uterine structure, right? And this canal is surrounded by, इसकी epithelium याद रखना important, exam में पूछते हैं. It is a tough epithelium because it has to bear the load of intercourse. And this tough epithelium is stratified, it is multiple layers, and it is a squamous epithelium. Just like, I mean, if you look at your skin, you have the same epithelium. The only difference is that vaginal epithelium is not keratinized, but the skin epithelium is keratinized. But they are both stratified squamous, right? And this canal leads to uterus. यानी इसके बाद आगे क्या है? Uterus. So that's how it is. इसकी जो measurement है, length is approximately 7 to 9 centimeter, and it is a much longer structure on the posterior wall because of the anatomy and the curves it has. और जो anterior wall it is about 7. So 6 to 7 on the anterior side, 7 to 9 on the posterior wall. The vaginal walls are normally in a position except the vault where they are separated by the cervix. So ये vault का structure, ये वाला structure है, where it is going to be basically joining the cervical area. The vault of the vagina is divided into 4 fornices, the posterior, anterior, and 2 lateral fornices. Mid vagina is a transverse slit, while the lower vagina is an H-shaped. It's not so important, but anyways, if you can remember that, right? The vaginal walls are lined with the transverse folds of mucosa, obviously. The vagina has no glands. This is so super important, and it's kept moist by the secretion from the uterus and the cervix. This is super important point, okay? This area is devoid of glands, no glands at all. But then how it is kept moist is by the secretion from uterus and cervix, okay? And also by transudation from the epithelial lining. So some of the liquids come out from the epithelial lining by transudation. जैसे transudate बनता है किसी भी inflammatory process में basically. But there are no glands in there. This is super important point. इसकी जो epithelium है vagina की, it is thick and it is rich in glycogen. And this is important because of the purpose it serves. However, before puberty and after menopause, the vagina is devoid of glycogen due to lack of estrogen. So that's an important link. No estrogen, no glycogen. Now, Doderen's bacillus is normal common cell. So this is again a super important point for you to remember. कि vaginal flora का most commonly present organism कौन सा है? So that is Doderlein's bacillus, normally present there, and it has a job to do there. इसका वहाँ पे काम है, ऐसे नहीं मौजूद ये. It breaks down glycogen to form lactic acid, and it keeps the pH around 4.5. So that's the role. Or this is also important. Why do we need an acidic pH there? Because this acidic pH is protective. And it prevents the growth of other microorganisms. So see how beautifully this structure is designed, right? Because this is one of the entry points into the body, right? All the entry points in your body, they have been provided with some sort of defense mechanism. So for example, if you take a look at your ears, for example, ear is an entry point to your body. So we have wax there, right? We have small hair-like structure so that things cannot enter easily. You look at your nostrils, you have hairs in there, mucus in there. You look at your trachea. So they are all protected. All the entry points of your body are protected, and vagina is no exception. The upper posterior wall of the vagina forms the anterior peritoneal reflection of the pouch of Douglas. The middle third is separate. So I would not go into these details for now because they are more sort of, you have done those in anatomy, and I'm not going to spend time just reading that. But remember that vagina is a gateway and a fibromuscular tunnel which basically leads to cervix and uterus. And here you see what we were talking about. मैंने इसको थोड़ा सा क्विकली पास कर दिया था, लेकिन अब इस डायग्राम में वी कैन एक्सप्लेन कि वजाइना जो है इसकी मोस्ट ऑफ द वॉल्स दे अपोज ईच अदर, बट वेयर इट ज्वाइंस द सर्विक्स इट हैज डिफरेंट फॉर्नाइसेस. देयर इज एन एंटीरियर फॉर्निक्स, पोस्टीरियर फॉर्निक्स, 4 रीजन्स हैं. और ये जो फॉर्निक्स वाली बात है यहाँ पे मैंने नहीं एक्सप्लेन की थी, बट लुक एट हियर, दिस इज मच मोर एविडेंट. सो दैट्स वजाइना, एंटीरियर पोस्टीरियर वॉल्स, एंड दे आर एक साथ चल रही हैं, देखें तो दे आर अपोज्ड विद ईच अदर. लेकिन जहां ये सर्विकल एरिया में ज्वाइन कर रहा है, सो इसके ये इस तरह से इंडेंटेशंस बन रहे हैं. सो देयर इज अ पोस्टीरियर फॉर्निक्स एंड देन देयर इज अनदर फॉर्निक्स. सो ये पॉइंट था जो वहां हमने छोड़ा था. एट बर्थ वजाइना इज अंडर द इन्फ्लुएंस ऑफ मैटरनल ईस्ट्रोजन, सो the epithelium is well developed. After a couple of weeks, the effect of estrogen from the mother disappear and the pH rises to 7 and the epithelium atrophies. At puberty, the reverse happens because estrogen starts appearing, right? And finally, the menopause, the vagina tends to shrink again and the epithelium atrophies once again. So vagina goes through these cycles depending on the hormonal status. Now let's talk about uterus, which is shaped like an inverted pear. So if you overall look at the uterus structure, that's how it looks like, inverted pear. And inferiorly, it has cervix, and it in a non-pregnant state, it is situated entirely in the pelvis. क्योंकि जब pregnancy होती है, so it goes up into the abdominal area, right? But ये non-pregnant में, it is primarily present in the pelvic region. It is hollow and has thick muscular wall. Actually 3 इसकी layers होती हैं. बीच में तो cavity है, then there is endometrium, फिर there is a thick myometrium, and then there is perimetrium. Its maximal external dimensions are, this is important, अक्सर एग्जामिनर को शौक होता है, पूछते हैं. So 7.5 सेंटीमीटर लंबाई में, 5 सेंटीमीटर वाइड है, and then 3 सेंटीमीटर thick है, right? So remember these dimensions if you want to, although this is highly variable. An adult uterus weighs about 70 grams. In the upper part, the uterus is termed as the body of the corpus, which is the upper part here. And the area of insertion of each fallopian tube, जहाँ पे fallopian tube आके attach होती है, let me see अगर कहीं diagram है, मैं बना के दिखा देता हूँ यार. So जिस जगह पे वो fallopian tubes आकर के इसकी body में attach होती है, if this is the uterus, so if these are the fallopian tubes, so this particular region is known as this is where the fallopian tubes basically enter, and this is known as cornu, right? और फिर इसके ऊपर का जो पार्ट है जहां पे fallopian tube अटैच होती है, इससे ऊपर का जितना पार्ट है ये वाला पार्ट, दिस इज कॉल्ड द फंडस. फंडस आपके स्टमक में भी होता है, if you remember the structure of जहां पे esophagus एंटर होती है, उसके ऊपर का जो पार्ट होता है, दिस इज कॉल्ड फंडस. बिल्कुल यहाँ भी ऐसे ही है कि जहां fallopian tube एंटर हो रही है, उसके ऊपर का जो पार्ट है, दैट इज कॉल्ड फंडस ऑफ द यूट्रस. तो ये डिफरेंट टर्मिनोलॉजीज हैं भाई जो आपको पता होनी चाहिए. The uterus, upper to the small constricted area, the isthmus, below is the cervix, or निचला जो लोअर पोर्शन है, दिस इज बेसिकली द सर्वाइकल रीजन. बाकी इसमें जो डिटेल्स हैं, आई एम नॉट इंटरेस्टेड इन दोज डिटेल्स टू मच. आई विल फाइंड आउट इफ देयर इज एनीथिंग इंपॉर्टेंट व्हिच वी नीड टू डिस्कस. द यूट्रस कंसिस्ट ऑफ 3 लेयर्स. ये बहुत इंपॉर्टेंट है. मैंने बात की कि जो आउटर लेयर है, दैट इज पेरिटोनियम, which is the outermost layer. Then there is a middle muscular layer, and then the endometrium. Super important because काफी सारे cancers इस endometrium में rise होते हैं. काफी सारे benign tumor हैं जो muscular layer में rise होते हैं, जैसे leiomyoma, leiomyomata, और काफी सारे endometrial cancers जैसे कि मैंने बताया, they arise from the endometrium. So these 3 layers are very important for you to understand. Now, जो outermost layer है, which is the peritoneum, is intimately attached to the subserous fibrous layer, except laterally where they spread out to form the leaves, which are called the broad ligament. So, broad ligament is very important. Uterus is kind of surrounded with the जो इसकी outer layer है, this is इसमें यूं इस तरह से lateral side पे इस तरह पूरा एक ligament बनता है, which is basically the peritoneal layer, and that is known as the broad ligament. It contains important structures जो हम आगे बात करेंगे. जो मायोमेट्रियम है, विच इज मस्कुलर, इट फॉर्म्स द मेन बल्क, जो 70 ग्राम है, इसमें सारा कंट्रीब्यूशन ज्यादातर इसी का है. सो इट कंटेन्स बेसिकली अ लॉट ऑफ मसल्स, एंड देन वंस द मसल्स आर देयर आर सो मच ब्लड वेसल्स एंड लिम्फेटिक्स एंड नर्व्स एंड ऑल दीज थिंग्स, राइट. देयर आर और जो मसल्स हैं वो भी दे आर वेरी nicely arranged, जैसे कि बहुत सारी और जगहों पे स्मूथ मसल्स होते हैं. So for example, there are longitudinal muscles which are the outer layer, then there are interlacing muscle fibers, and then सबसे इनर जो है दीज आर सर्कुलर मसल्स। और जो एंडोमेट्रियल लेयर है इसकी इंपॉर्टेंस ये है कि भाई दिस इज द लेयर विच शेड्स ऑफ with every menstrual cycle, and then it regenerates again. This is one importance. And the other thing is that it also is the source of uterine cancer in many female. Uterine cancer, endometrial cancers are pretty common. Okay, now cervix is it demands specific attention because cervical cancer itself is a big thing, right? It is the lower part of the uterus. It is narrower than the body of the uterus and approximately 2.5 centimeter in length. So if this is the uterus, it leads into cervix, and then cervix ke saath phir there is vagina. So that's the kind of a structure it has. Lateral to the cervix lies the connective tissue called the parametrium, and the uterus runs about 1 centimeter laterally to the supravaginal cervix within the parametrium. Not so important point for you at the moment. The posterior aspect again. The upper part of the cervix mostly consists of involuntary muscles, whereas the lower part is mainly the fibrous connective tissue, which is then joining with vagina. The mucous membrane of the cervix has anterior and posterior columns. They create actually folds, the mucus folds, and they are called arborvitae. It has numerous deep glandular follicles, so it contains glands, okay? And they secrete alkaline mucus. देखें ये बड़ा important है. Vagina में environment क्या था? Acidic. Cervix में environment क्या है? Alkaline. And this is very, very important. And the epithelium of the endocervix is columnar. जबकि वजाना में मैंने आपको क्या बताया था? स्ट्रैटिफाइड स्क्वामस. तो ये डिफरेंसेस आपने सारे भाई याद रखने हैं. इट इज ऑल्सो सीलिएटेड इन द अपर 2/3. सो व्हाट इज द एपिथेलियल लाइनिंग इज इंपॉर्टेंट फॉर यू. दिस चेंजेस टू स्ट्रैटिफाइड स्क्वामस अराउंड द रीजन ऑफ द एक्सटर्नल ऑस, यानी जैसे नीचे आ रहे हैं वजाना के करीब, इट बिकम्स स्ट्रैटिफाइड स्क्वामस. सो फ्रॉम स्ट्रैटिफाइड, अगर हम इफ वी आर गोइंग फ्रॉम वजाना टू द सर्विक्स, देयर इज अ लॉट ऑफ स्ट्रैटिफाइड स्क्वामस एंड देन बिकम्स कॉलुमिनर. अगर हम ऊपर सर्विक्स से नीचे की तरफ बात कर रहे हैं, सो फ्रॉम कॉलुमिनर इट बिकम्स स्ट्रैटिफाइड squamous. That's how it works. Okay, actually there is a junction also very much visible, which is the squamo-columnar junction. So squamo because stratified squamous, and then suddenly comes the columnar area. So एक junction नजर आता है इनके बीच में, where you have the columnar cells and then the squamous cells. So that point is called squamo-columnar junction. Now, 8 changes to the anatomy of these female structure. The disappearance of maternal estrogen. ये बड़ा इंपॉर्टेंट पॉइंट है. देखिए, when the baby is born, the baby still has the effect of maternal estrogen. माँ की बॉडी से estrogen आया हुआ है इसके अंदर, वो अपना ज़ाहिर है उसका अपना इन्फ्लुएंस होता है. और सिर्फ एक estrogen नहीं है, बहुत सारे हार्मोन्स आते हैं, थायराइड हार्मोन्स आते हैं, वो अपना काम कर रहे होते हैं. There are so many other hormones also coming from the mommy, but with the passage of time, 2-2.5 हफ्ते, and those hormones are then dead. So उनका फिर इफेक्ट नजर आता है. So disappearance of the maternal estrogen from the circulation after the birth first causes the uterus to decrease in length. तो यूट्रस पे पहला इफेक्ट आपने देखा, अबाउट 1/3. इतना देखें, इतना डिफरेंस आ जाता है यूट्रस में, और उसके वेट में भी अबाउट 1/2. सर्विक्स इज देन ट्वाइस द लेंथ ऑफ द यूट्रस, यानी देयर इज अ टाइम व्हेन सर्विक्स इज इवन बिगर than the uterus when the maternal mommy's estrogen goes away. Now during the childhood, जब मजीद बात आगे बढ़ती है, the uterus starts its growth slowly in length and it goes with the age. The average longitudinal diameter ranges from 2.5 centimeter at the age of 2 to 3. So some people are interested in asking these numbers, so you can remember if you want to. After the onset of puberty, the anterior, posterior, and the transverse diameter of the uterus, they start to increase, and after puberty, obviously, it comes into full shape. And the increase in the uterine volume continues well after menarche, and at the menopause, the uterus atrophies again, and things again go in the reverse direction. So when the baby is born, there is maternal hormones such as estrogen. Once they are gone, there are atrophy. Then puberty pe dobara there is increase in size, and then at menopause things go in the negative direction again. Now the fallopian tubes. Now fallopian tubes extend outward from the uterus, और uterus में जिस जगह वो आके अटैच होती है, कॉर्नू, ये नाम मैंने पहले बताया आपको, and they go near the ovaries. So basically structure जो है वो इस तरह से aligned है कि there is vagina, then there is cervix, and then there is uterus. और यूट्रस से फिर ये इस तरह से fallopian tubes निकल रहे हैं, एंड देन यूट्रस का ऊपर का हिस्सा फंडस है, एंड देन देयर आर ओवरीज. सो बेसिकली होता ये है, और ये स्ट्रक्चर इस तरह से डिजाइन क्यों किया गया है, बिकॉज ओवरी से निकलता है ओवम. ओवम कम्स इन द fallopian tubes. It travels in the fallopian tube, and from the vaginal area, because of intercourse, if sperms are released, they travel up to this area, and this is where the fertilization then happens, and then the zygote comes in and settles in the uterus. So ये पूरा स्ट्रक्चर इस तरह से बेसिकली डिजाइन है. तो fallopian tube is a connection between the uterus and the ovary. At the abdominal ostium, यानी it's an open end here ना, तो इसको हम ostium कहते हैं. It opens into the peritoneal cavity. So basically the female genital tract, the peritoneal cavity is connected. तो ये पूरा जो exterior है, it is in a way connected to the interior of the peritoneum by the fallopian tubes. And there is a communication of the exterior of the body via the uterus and the vagina. So that's the point that I was making. So if somebody asks you कि क्या exterior आपकी body के interior के साथ connected है? Yes, very much. और ये सिर्फ एक point नहीं है. There are so many other points in the body as well. I mean, think about your ears, think about your nose, think about your oral cavity, think about your anal cavity. But obviously, anal cavity is it leads to the digestive tract. वो एक ट्यूब है, बट यहाँ तो the exterior is then getting into the peritoneum. तो ये बिल्कुल आपके internal environment के साथ connected है. This is essential to allow the sperm and egg to meet. मैंने आपको बताया, this is the meeting point for sperm and ovum, so that you get the zygote form. The fallopian tubes convey the ovum from the ovary towards the uterus and promote oxygenation, nutrition, and everything. So अभी जो मैंने आपसे बात की कि एक दफा zygote बन गया तो it travels down into the uterus, settles there. Alright. So इसके different parts अगर हम बात करें fallopian tube के, it's about 10 centimeter long. It's a long tube. There is an interstitial portion, isthmus, ampulla, infundibulum. So there is an infundibulum area which actually fimri bhi hoti hai. So they actually catch the ovum. Infundibulum में it comes in there. Then there is a long part, and then it gets into the uterus, and that area is called isthmus. So इसमें कोई इतनी ज़्यादा डिटेल्स है नहीं जो एग्जाम में पूछी जाए, बट ये सिंपल कॉन्सेप्ट आपको पता होना चाहिए. ओवरी का स्ट्रक्चर जाहिर है इसकी अलग से आपने पूरी एनाटॉमी में पढ़नी है, यहाँ पे थोड़ा सा ब्रीफ किया है. सो द साइज एंड अपीयरेंस ऑफ द ओवरी डिपेंड ऑन बोथ द एज एंड द स्टेज ऑफ द menstrual cycle. So the size keeps on changing. In a child, the ovaries are obviously small, about 1.5 centimeter long, but they increase in the size during the puberty. In young adults, they are almond shaped. They become almond shaped like this, and they're 3 centimeter long. See, 1.5 centimeter wide, and so they become pretty big during the reproductive age time period. After the menopause, no active follicles, because remember I told you follicles, they atrophy and they go away, and then ovary becomes smaller again. So इसमें कोई मुश्किल चीज तो है नहीं, right? The ovary is the only intra-abdominal structure not to be covered by the peritoneum. Important point. Each ovary is attached to the cornu of the uterus by the ovarian ligament. Another important point. हमने round ligament पीछे हल्की सी बात की थी, अब ovarian ligament आपको पता होना चाहिए. It's connected, ovary is connected with the uterus. Okay. All right, okay. Laterally, each ovary is attached to the suspensory ligament. So they are suspending in the peritoneum by the way of these ligaments. Remember, suspensory ligament, round ligament, broad ligament, and ovarian ligament. Anterior to the ovaries lie the fallopian tubes and superior portion of the bladder. So ovaries are also in connection with the bladder. Okay. ओवरी हैज अ सेंट्रल वैस्कुलर मेडुला. जैसे ज्यादातर हमारे जो ऑर्गन्स हैं, आप किडनी को भी देखें, सो देयर इज अ कॉर्टेक्स आउटर लेयर एंड देन देयर इज मेडुला. एड्रिनल ग्लैंड में भी ऐसा है, ओवरी में भी ऐसा है. तो सेंट्रल पोर्शन इज ओवरी. इट कंटेन्स बेसिकली लूज कनेक्टिव टिश्यू एंड सम इलास्टिक फाइबर्स, इवन सम नॉन स्ट्राइएटेड मसल्स. मेनी स्टूडेंट्स डोंट इवन नो कि ओवरी में मसल्स हैं. जब मैं उनसे पूछता हूं उन्हें पता ही नहीं होता कि ओवरी में मसल्स भी होते हैं. जी जनाब, उनके लिए बड़ा सरप्राइज है. सो ओवरी कंटेन्स सम स्मूथ मसल्स इन द मेडुला. इट हैज एन आउटर थिकर कॉर्टेक्स एज वेल, and it is even denser than medulla, and this is where there's so many things present. There are reticular fibers, fusiform cells, and so many things are there. The surface pe jo covering hai, that is primarily a layer of cubital cells, which is what we call the germinal epithelium. And is germinal epithelium ke niche there is an ill-defined layer of condensed connective tissue which is called tunica albuginea. So the epithelial layer, then tunica albuginea, then the cortex. Okay. At birth, numerous primordial follicles are found in the cortex. So cortex is the region where the follicles are present, okay? But some are also found in the medulla, but most of them in the cortex. With puberty, some from each month, they grow into Graafian follicle, and then the menstrual cycle happens and the ovum is released, all right? Which we will cover in the upcoming chapters. तो यहाँ ये जो सारा ग्राउंड सेट कर रहे हैं ना, आपको ये सारी लेयर्स वेयर्स बता रहे हैं, एपिथेलियम बता रहे हैं, दे आर ऑल गोइंग टू बी यूज्ड इन द अपकमिंग चैप्टर्स. तो फिर वहां पे डिस्कस नहीं होगा, ऑब्वियसली डायरेक्टली बात होगी कि कॉर्टेक्स में ये हो रहा है, मेडुला में ये हो रहा है. सो वी विल अज्यूम कि यू नो कि कॉर्टेक्स क्या है, मेडुला क्या है. ओके. नाउ सम सराउंडिंग स्ट्रक्चर्स, ये तो हो गए, हमने बात की ओवरी की, फ्लोपियन ट्यूब और इंटरनल जेनिटेलिया की. नाउ देयर आर आल्सो सम इंपॉर्टेंट सराउंडिंग स्ट्रक्चर्स, और उनके बारे में कुछ इंपॉर्टेंट फैक्ट्स हैं जो आपको समझना और बताना जरूरी है. दे इंक्लूड द ब्लैडर, यूरेथ्रा एंड यूरेटर. दे आर इन क्लोज प्रॉक्सिमिटी विद द इंटरनल जेनिटेलिया, सो इट्स वेरी इंपॉर्टेंट टू अंडरस्टैंड सम की इंपॉर्टेंट फीचर्स अबाउट देम. अब ऑब्वियसली यहाँ पे पर्पस ये बताना आपको नहीं है मुझे कि ब्लैडर जो है इट इज मेड अप ऑफ इनवॉलंटरी मसल्स. ये तो ब्लैडर की अपनी एनाटमी के लेक्चर्स में आप पढ़ोगे, या इसकी कैपेसिटी कितनी होती है. बट इंपॉर्टेंट थिंग्स मैं आपको बताता हूँ जो गायनेकोलॉजी के हिसाब से इंपॉर्टेंट है ना, वो इंपॉर्टेंट है. सो फॉर एग्जांपल, जो बेस ऑफ ब्लैडर है दिस इज वेरी एडजेसेंट टू सर्विक्स. दिस इज एन इंपॉर्टेंट पॉइंट. तो सर्विक्स में कोई भी इशू, ब्लैडर very very important. I mean think about it. If the bladder is full and your partner is complaining ke I need time to urinate before we can have intercourse, that is absolutely understandable, because cervix is where, you'll be having intercourse through vagina, pushing up onto the cervix, there will be abdominal pressure, and bladder is just right there. So if it is full, cervix, any activity in the cervix will be affecting. And there's a very thin layer of tissue actually intervening between cervix and bladder. Important point. That's one example that I've given, but there are other examples as well. For example, if there is any disease which is involving cervix, can easily penetrate to bladder and vice versa. It is separated from the anterior vaginal wall below by the pubico-cervical fascia. Even if you don't remember this name, just remember कि stretched to the pubis and cervix, cervix and bladder and vagina close by. Not vagina, but cervix and bladder absolutely. Okay. अच्छा, फिर यहाँ जो इन्होंने ये बात की है, दिस इज ऑल बेसिकली द एनाटमी ऑफ ब्लैडर इटसेल्फ, व्हिच इज नॉट माय टॉपिक एट द मोमेंट. नाउ यूरेथ्रा, अगेन इंपॉर्टेंट एनाटमिकल इसके लिंक्स हैं विद द फीमेल जेनिटल ट्रैक्ट. द फीमेल यूरेथ्रा इज अबाउट 3.5 centimeters long. दे गो एक्सप्लेनिंग देयर हिस्टोलॉजी. ट्रांजिशनल एपिथेलियम है. आई डोंट थिंक आई एम गोना गो इनटू दीज डिटेल्स, बट द इंपॉर्टेंट पॉइंट्स अगेन कि जो यूरेथ्रा है, Zairo, obviously it is opening into the vestibule now. So you must understand that it passes through the two layers of the urinogenital diaphragm, and by some muscles it is covered, but then it enters into the vestibule. Now vestibule is the area जहाँ पर vagina मौजूद है, जहाँ पे glands मौजूद हैं. This is the connection for urethra. And if so, let me give you a clinical scenario. For example, vestibule में there are glands, right? If these glands are इनकी ducts obstruct होती हैं, inflammation होती है, this inflammation can get to the urethral opening, from urethra to the ureters, so ascending urinary tract infection, which is also very common in females, right? So that's the kind of clinical correlation that you must understand. और इसीलिए ये पढ़ा रहे हैं यहाँ पे कि these structures are in close proximity with the female genital tract. Okay, not more than that. Now the ureters, they cross the pelvic brim and they lie in front of the bifurcation of the iliac artery. Now that's important because अभी मैं blood supply पढ़ाऊंगा आपको female organs की, तो iliac arteries and crossway of the arterial supply and the ureter is important because अगर कोई सर्जरी करनी है फीमेल जेनिटल ट्रैक्ट के ऑर्गन्स की, यू मस्ट टेक केयर ऑफ द यूरेटर. ये नहीं है कि आप उनकी आर्टरीज को अगर ब्लॉक कर रहे हैं, पता चला आपने गलती से यूरेटर को ब्लॉक कर दिया है, बिकॉज इट रन्स डाउनवर्ड्स एंड फॉरवर्ड ऑन द लेटरल वॉल ऑफ द पेल्विस. अभी आप सुनिएगा इंपॉर्टेंट पॉइंट कि इट एक्चुअली is attached to the peritoneum of the back of the broad ligament. A broad ligament is something जहां से यूट्राइन आर्टरी भी गुजर रही है. सो यूट्रस को जो आर्टरी जा रही है उसके बिल्कुल करीब है यूरेटर, तो दे टू कैन बी कंफ्यूज्ड. It then passes through the fibrous tunnel, the ureteric canal in the upper part of the cardinal ligament. Finally, it runs close to the lateral vaginal fornix. Another important point, जहां पे वजाइना सर्विक्स के साथ अटैच हो रहा है, वहां पे मैंने आपको बताया था 4 फोर्नाइसिस बनते हैं, उनमें से एक के पास यूरेटर गुजरता है. सो यूरेटर इज इंपॉर्टेंट एनाटॉमिकल रिलेशन टू फीमेल जेनिटल ट्रैक्ट. इसकी ब्लड सप्लाई कहाँ से है और कहाँ से नहीं है, आप इसकी एनाटॉमी में पढ़ेंगे, राइट? बट रिमेंबर कि ब्लैडर, यूरेथ्रा, यूरेटर, दे मस्ट बी कंसिडर्ड. बल्कि इन्होंने अलग से देखें, इंपॉर्टेंट है, ये बॉक्स भी दे दिया है, यूरेट्रिक डैमेज ड्यूरिंग हिस्टेरेक्टमी. यानी जब आप यूट्रस निकाल रहे हैं तो इस दौरान बड़ा कॉमन है कि यूरेटर में डैमेज हो सके, बिकॉज यूरेटर जब निकालेंगे, से फॉर एग्जांपल किसी को अगर एंडोमेट्रियल कैंसर है तो उसमें यूट्रस निकालना होगा. दिस इज व्हाट वी कॉल हिस्टेरेक्टमी, रिमूवल ऑफ यूट्रस. तो इसकी ब्लड वेसल्स भी निकालेंगे, ब्लड सप्लाई भी निकालेंगे. एंड इफ यू आर रिमूविंग यूट्राइन आर्टरी, कौन गुजर रहा है यूट्राइन आर्टरी के साथ ब्रॉड लिगामेंट में? यूरेटर. So there are chances you damage the ureter, right? Because of its close relationship with the cervix, vault of vagina and the uterine artery, इस hysterectomy के operation के दौरान ureteric damage काफी common है. Okay. Now a few words about rectum. Rectum extends from the level of the third sacral vertebrae to the point about 2.5 centimeter in front of the coccyx, where it passes through the pelvic floor to become continuous with the anal canal. Now, these structures are anyway very close to the female genital tract. आपको याद है कि मैंने इसी वीडियो के स्टार्ट में ये बात आपको बताई थी कि from the cloacal membrane उसमें फिर anterior और posterior part हो जाता है. जो posterior part है, it gets into the the distal portion of the GI tract, but the anterior part gets into the female genital tract. So they are very closely related. So female genital tract के lower part के बिल्कुल posterior side पे rectum is a natural relationship, right? So that is what you need to understand. इम्पॉर्टेंट है क्योंकि इसके साथ सर्विक्स और वजाइना का इंपॉर्टेंट रिलेशन रेक्टम के साथ. नो रेक्टल कैंसर्स, एनल कार्सिनोमा, वेरी कॉमन, नहीं? सर्वाइकल कैंसर, सो द कैंसर्स कैन गो इनटू द रेक्टम, द रेक्टल कैंसर गो इनटू द सर्वाइकल रीजन. Pretty common. They're close to each other. Now the pelvic muscles and the ligaments, the fascia, this is something which I would recommend कि इसको आप ज़रा एक दफ़ा ना मेरे जो पेरिनियम के एनाटमी के लेक्चर है ना BD चौरासिया से, वो ज़रा स्पेसिफिकली पढ़ लीजिएगा क्योंकि वो बहुत हेल्प करेंगे आपको इस चैप्टर को भी समझने के लिए और पूरी गायनेकोलॉजी को समझने के लिए. सो बट एनीवेज विल गो थ्रू दिस. द पेल्विक डायफ्राम आपको इफ़ यू रिमेंबर इज फॉर्म बाय फ्यू मसल्स, और वो मसल्स कौन से हैं? इट्स फॉर्म बाय लिवेटर एंड आई मसल्स, which are broad, flat muscles, the fibers of which pass downward and inward. The two muscles, one on either side, constitute the pelvic diaphragm. अब ये अगर आप डायग्राम देखें, so this is the pelvic diaphragm. Is the area जिसमें से बहुत सारे important structure जैसे कि urethra, vagina, rectum ये pass out होते हैं, तो ये जो सारा एरिया है, this is the diaphragm, right? ये आपको पेल्विक फ्लोर के मसल हैं. पेल्विक फ्लोर पूरे का पूरा आपको अच्छे से समझना है भाई. नाउ द लोअर पार्ट ऑफ द बॉडी ऑफ द ऑस प्यूबिस, ये जो मसल्स हैं ये यहाँ से ओरिजिनेट होते हैं. ओरिजिनेट एंड इंसर्शन नॉट इम्पॉर्टेंट फॉर द टाइम बीइंग. The levator and eye muscles are inserted into the following points. Again, origin, insertion, I'm not going into the details. So they are जो भी surrounding structures हैं, जो pubic bones हैं, जो coccygeal points हैं, जो lateral surrounding structures हैं, even ligaments, उन सब के साथ ये attach होते हैं and they kind of form this pelvic floor. Okay. The medial borders of the pubococcygeus muscle pass on either side from the pubic bone to the peripheral. Again, not important. Just याद ये रखना है कि बहुत सारे structures इनको traverse करते हैं and any damage to these muscles during surgery. So, for example, if somebody is doing surgery pervaginally, either to do for example hysterectomy, we can do it from here. Laparoscopically भी करते हैं और pervaginally भी we can do that. But regardless of that, even delivery भी अगर हो रही है, so these muscles can be damaged, right? So the important point कि बहुत सारे important female genital tract structures, they are traversing this pelvic floor. Important point. Now, urinogenital diaphragm, also known as the triangular ligament, is made up of two layers of pelvic fascia that fill the gap between the descending pubic rami. Again, too much anatomy, not going into the details. I'm just finding out some important points for you to understand. Now, this is something that we need to focus on. The ovarian ligament and the round ligament. Super important. Now, let me find the diagram for you. And because ये दोनों जो ligaments हैं, this is something जिस पे एग्जाम का बहुत फोकस होता है. The ovarian ligament lies beneath and posterior layer of the broad ligament and passes from the medial pole of the ovary. Listen to this point. Medial pole of the ovary to the uterus just below the point of entry of the fallopian tube. So let's go to the diagram. This is diagram 1.5a. Let's look at this diagram and try to figure out where is this particular ligaments. Remember, the ligament that we are talking about at the moment is the ovarian ligament and the round ligament. So if you look at the diagram, this is the broad ligament, which is from the lateral part of the uterus up till to these lateral structure, the broad ligament, and this is the round ligament, which is connecting the ovarian pole with the uterus. So that round ligament is something that you just cannot miss. Okay, this is vagina, cervix. These are the fornix area where vagina combines with the cervix, then cervical region, endometrium, myometrium, perimetrium, and this is all the broad ligament, and you see this round ligament here. Okay. This is then the cut through this particular portion. You see ovary, the fimbriae, the fallopian tube and you've cut it here to see the round ligament of the ovary. जो ये है इसका कट कर रहे हैं तो इसके अंदर क्या क्या चीजें देखें. इसके अंदर जो हमने ये round ligament की बात की थी, the structures that you see are the ovarian vessels obviously. You see a particular ligament which goes to the ovary inside this round ligament structure, and that is known as the round ligament of the ovary itself. And then there is a round ligament of the uterus which is connecting to the uterus. So एक टेंट होता है ना, टेंट को पकड़ने के लिए ऐसे बम्बू लगाते हैं, फिर एक रस्सी लगाते हैं. So बहुत सारी रस्सियां हैं ताकि ओवरी अपनी प्लेस में रहे, सारे स्ट्रक्चर्स अपनी जगह में रहें. So remember, this is, I would say, a 5-star important diagram कि round ligaments, उसके अंदर के स्ट्रक्चर्स क्या हैं, what is the concept of the broad ligament. Remember this. This is super important, ladies and gentlemen. Okay. All right. So now the pelvic fascia and the pelvic cellular tissue, the connective tissue fills the, again, this is too much of the details pertaining particularly to the anatomy. I don't find it so relevant here. But the blood supply is important. I will spend some time here. Arteries supplying the pelvic organ, because the ovary develops on the posterior abdominal wall and later it migrates into the pelvis. Remember, testis में भी याद है ना कि वो develop होता है in the abdominal cavity, then goes down. So ovary में भी origin कहीं है, और अब जाहिर है blood supply वही होती है जो origin की जगह होती है. So if the ovaries are developing in the abdominal wall, it carries the blood supply from the abdominal aorta. So this is important point. Embryology का basic principle है ये. The ovarian artery arises from the aorta. So it comes from aorta basically, just below the renal artery, and runs downward on the surface of the psoas muscle. Not important कि कहाँ से आ रही है, कैसे आ रही है, but point ये है कि जो ovary की artery है, the ovarian artery, it comes from the aorta. Super important. Okay. Now, internal iliac, also called hypogastric artery. This vessel is about 4 centimeter in length. Not important. Begins at the bifurcation of the common iliac. This is important. In front of the sacroiliac joint. Soon divides into anterior and posterior branches. And the branches that supply the pelvic organ are all from the anterior division. सिंपल, इस लाइन को बार बार पढ़ें, समझ में आ जाएगी, राइट. तो जहां बाइफर्केशन होनी है वहां से ये आर्टरी निकलती है, फिर वो अपनी एंटीरियर और पोस्टीरियर ब्रांचेस में डिवाइड होती है. जो एंटीरियर ब्रांचेस हैं, दीज आर द वंस व्हिच सप्लाई द फीमेल ऑर्गन्स. इससे ज्यादा सिंपल करके बताया ही नहीं जा सकता. ओके, सो लेट्स मूव अहेड. द नेक्स्ट कॉन्सेप्ट is the vaginal artery. It runs obviously and supplies vagina. इससे पहले कुछ रह गया है, हाँ ये. The uterine artery provide the main blood supply to the uterus. Of course, इसका नाम है. The artery first runs around on the lateral wall. Not important. Not important. In this part, ये इसका पूरा, आई वुड नॉट सजेस्ट कि आपको टेरिटरी याद हो कि कहाँ से निकल के फिर लिटरली कहाँ बाउंड होती है वगैरह वगैरह वगैरह. सो इट्स ऑल नॉट सो इम्पॉर्टेंट. आपको मेजर कॉन्सेप्ट्स पता होने चाहिए कि हाउ इज द आर्टरी, यू नो, कमिंग फ्रॉम वेयर इट इज कमिंग, और कौन से ऑर्गन को कौन सी आर्टरी सप्लाई कर रही है. सो ये जो लाइंस है ना यहाँ पे, दीज आर सुपर इम्पॉर्टेंट. ये अगर आपको नहीं आती देन यू आर स्क्रूड अप. अगर ये आती हैं, यू आर फाइन. Then there are vesical arteries which supply the bladder. These are all the branches coming from this anterior division of the artery that we just discussed. Okay. All right. Good. Let's move on. Pyramidal rectal hair, then prudental supplies the pelvic cavity. It's coming from sciatic foramina. I'm not interested. It's not an anatomy class. It's gynecology lecture. Then the superior rectal. This is the continuation of the inferior mesenteric artery, and it supplies primarily to rectum. Then obviously the veins which drains the same way. So veins around the bladder, uterus, vagina, and rectum, they form actually a plexus, which communicate with each other. Obviously, all the veins, they freely communicate. And venous drainage from uterine vaginal vesical plexus is chiefly into the internal iliac veins. So the veins go in the reverse order of what the arterial supply was. Okay. Now, venous drainage from the rectal plexus, there's a plexus also around rectum, goes into superior rectal veins, to the inferior mesenteric veins, and then ultimately to the iliac veins. Similarly, जो ovarian veins हैं, इसका तो aorta का route था. यहाँ भी plexus है, which is called the pampiniform plexus, and it lies between the layers of the broad ligament. At first, there are two veins on each side, which correspond to the artery, and higher up the vein becomes single, they merge. So there's plexus, then two veins, then the two veins merge, they go up and they end into the inferior vena cava, and that on the left side, right side inferior vena cava, and on the left side goes into the left renal veins. Kind of the similar thing if you recall the testicular venous return, right? All right, so with that, let's move further and talk about the lymphatics. Pelvic lymphatics, बेसिकली फ्रॉम द लोअर एक्सट्रीमिटीज जब हम लिम्फ ड्रेनेज की बात करते हैं लोअर एक्सट्रीमिटीज एंड वल्वा एंड द पेरिनियल रीजन it's all filtered through the inguinal lymph node and the superficial femoral set of lymph nodes before continuing to the deep pathway. So basically they drain into inguinal and superficial nodes of the femoral region, then they go deep inside, right? Which is present inside around the walls of the pelvis. Once deep chain passes upward lateral to the major blood vessel, forming internal the external iliac and the comet. So they go into the para-aortic group of lymph nodes and then upward. So basically from all this area, the lower limb area as well as the perineal region, they go initially to the superficial, which are inguinal and superficial femoral. From there, after filtration, go into the deep nodes, and from deep node they travel upward through the para-aortic, which are around side the aorta. So that's how the design is. So this is lower extremity, this is the perineal organs. They first go into the inguinal and this is the inguinal group of lymph node, for example, then gets into deeper nodes, and then from the deeper nodes into the upward journey, which is the para-aortic node. So that's the simple concept, right? Now, medially, another chain of vessels passes from the deep femoral nodes through the femoral canal, obturator. So obviously, lymph nodes का जो channel है वो बड़ा complicated, and they are all moving from all the directions towards the heart. Obviously, you know that, yeah. तो यहाँ पे भी ऐसा ही है, इसमें कोई अलग से बात नहीं है. So lymphatics go para-aortic chains, and then they keep on going. From the leg and pelvis into the upper trunks, cisterna chyli, and then from here all the lymph is carried by the thoracic duct through the thorax into the intervening nodes and ultimately into left subclavian and interjugular. So simple pattern है, नीचे से lymph collect हुआ ऊपर जाकर जो subclavian में ultimately और internal jugular में चला जाएगा. ये तो lymphatics का पूरी body में general formula यही है, right? Lymphatic drainage from genital tract. The lymph vessels from the individual parts of the genital tract drain into the system, the pelvic lymph node. So ये तो हम बात कर रहे थे ना कि ये सारे जो हम lower limb और perineal region की बात करते हैं. So that's basically the external part of the body. If we talk about the deep internal organs of the genital tract, basically तो ये सब deep nodes में ही enter होते हैं first, not into the superficial nodes. Like अगर हम for example vulval region की बात कर रहे हैं या perineal region की बात कर रहे हैं, so they go into the superficial system, then into the deep system. लेकिन अगर organs deep ही हैं already, तो they start with the deep system, right? So vulva, perineal, and the skin, which is around the perineal region, contains superficial lymphatics. ये बात हम कर चुके हैं. But now let's talk about the internal genitalia. Lymphatics of the lower third of the vagina follow the vulvar drainage line to the superficial node. This is important. Although vagina becomes part of the internal genitalia, but iska jo lower third hai is still drain into the superficial nodes, and then from there it gets deep. Lekin things will change. So if you talk about, for example, lymphatics of the cervix, it either passes laterally in the base of the broad ligament. Now things are moving deep. अब ये internal movement है, and they are going into the deep nodes and ultimately to the para-aortic nodes. इसमें कोई, there is no rocket science in that, right? Most of the lymphatic vessels of the body of the uterus, they join the lymphatic drainage from the cervix, or they are then following the same channel to the inguinal node and then up via the para-aortic nodes. The ovary and the fallopian tube, they have a plexus of vessels that drain along the infundibulopelvic folds to the para-aortic nodes. So deep, deep, deep. Okay. Lymphatic drainage from the bladder and the upper urethra to the iliac nodes, which are basically joining hands with that of the vulva. So some parts are still draining into the superficial area, although these are deep organs, but draining into the superficial pathway. Okay. Now lymphatic from the lower anal canal drain to the superficial, because that's the lower, जैसे lower vaginal था was into the superficial inguinal lymph node. Similar is the lower anal canal. Okay, but then as you move deeper, then you start focusing on the deeper nodes, the para-aortic, the nodes around the deeper vessels. Okay. When we talk about the nerve supply of the vulva and perineum, is the pudendal nerves, which arise from the second, third, and the fourth sacral nerves as it passes along the outer wall of the ये इसका trajectory important nahi hai. The perineal nerve gives sensory supply to the vulva and also innervates the anterior part. This is, go read it, guys, and you have to remember this. What nerve supplies what area? There's no rocket science. You need to study. You need to remember that, okay? Now, the key learning points from all the discussion that we have been having so far is that adult uterus consists of 3 layers. Name them: peritoneum, myometrium, and endometrium. And from the peritoneum, you know the broad ligament is there, right? Cervix is narrower than the body of the uterus, and is approximately 2.5 centimeter in length. Cervix ka aapko pata hai. So all these points we've actually covered, and these are the key learning points, okay? Now, towards the end of the chapter, we have to talk about the structural problems during embryogenesis, basically. So Mullerian abnormalities, these are very common, and they occur up to 6% of the female population. It's a big number. 6% is a big number, but they may be asymptomatic. That's important, and because things are working and they get pregnant and the babies are born, so that's not a big deal. The etiology is unknown. We don't know what causes it, although the associated renal anomalies are present in up to 30%. So maybe there is an association between renal development and genital development. Although अगर आप ये देखो भी ना, embryology है भी ऐसे कि there was the kidney ridge, the mesonephric ridge, and then the genital ridge, है ना, करीब करीब है. So maybe in future we know कि कुछ genetic impression है renal development का on the genital development, which we don't know at the moment, but maybe in future we know that, right? So Mullerian obstruction, for example, failure of complete canalization of the Mullerian structure can lead to menstrual obstruction. This is important. If there is no canalization, no cavity form, no menstrual blood, right? The obstruction most commonly occurs at the junction of the lower third of the vagina and the hymen area. Presentation with the imperforate hymen is usually with the increasing abdominal pain. The baby is getting, towards the age of menarche. There is imperforate hymen. The blood is not coming out. Abdominal pain. Treatment is simple. Do surgical incision and you remove the retained blood. So that's how we deal with that. Okay, but this is something common. This is not something very uncommon. Mullerian duplication. Duplication of the Mullerian system can occur, resulting in wide range of abnormalities. It may be complete duplication, यानी पूरे 2 cervix हैं, 2 uterus हैं, सब चीजें 2 हैं, 2 vagina हैं, but this is rare, okay? But sometimes it may be a midline uterine septum and otherwise normal internal genitalia. And there will be 1 vagina, 1 cervix, but then the uterus जो है, वो actually 2 uterus हैं. All these things can happen, right? So for example, if you look at this is the normal uterus, right? These are structural abnormalities, your T-shape or your infantile uterus. This is not so important, but here you see, this is complete duplication. So if you look here, this is septate uterus. So uterus का एक cavity ये बन गया. Down there is everything okay. Cervix is okay, and the vagina will be okay. 1 vagina, 1 cervix, but 2 composition here. 2 अलग-अलग यूट्रस. यहाँ पे भी देखिए 2 यूट्रस बनने का सिस्टम है, लेकिन ये completely नहीं है. So this is called partial duplication. Okay. Here you see, ये बिल्कुल ही पूरे 2 सिस्टम अलग-अलग बने हुए हैं ना. ये यहाँ पे एक यूट्रस की बॉडी सेप्टम से डिवाइड है, यहाँ पे यूट्रस ही 2 अलग डेवलप हुई है. देखिए ये और ये. So these are different forms of Mullerian dysgenesis that you can have. Okay. Sometimes this happens. You see, you have a rudimentary cavity. So development की जो abnormalities हैं वो बड़ी common हैं और अक्सर होती हैं if things go wrong, and sometimes they do, right? Mullerian agenesis. This is agenesis, complete absence, right? Mullerian system does not develop, resulting in an absent or rudimentary uterus in upper vagina. So bana hi nahi, there is no Mullerian system. This condition is known as Rokitansky syndrome and MRKH syndrome. So Meyer, Rokitansky, Kuster-Hauser syndrome. Against the name of the physicians and scientists. The ovaries function normally because ovary development is different from the development of the ducts. Ovaries develop from the genital tubercle, genital ridge, and the system is developed from the Mullerian duct system. So if Mullerian system is not working, ovary will still be there. So ovary is working, right? So they function normally, and the most common presentation is with primary amenorrhea. They never bleed. There is no even no start of the menarche, no start of the menstrual cycle. The etiology of this condition is obviously not known, like many other embryological problems, and treatment is focused on largely on the psychological support because it's not much that you can do. Some people do some hormonal support, but what would you do at the end of the day if there is no, anatomical structure present? If the Mullerian system just did not develop, you can't help it, right? Vestigial structure, sometimes there are some structures, some part of the ducts and the tubules which are there, not doing anything. Many of the time they're not even noticed, right? Ab 10 teachers mein ye hai ki towards the end of each chapter there are some questions, some practical and practice case scenarios. So let's go through them. There's a case history. 15-year-old girl was seen in the gynecology clinic with her mother. Because jitni anatomy dekho aap padhoge na, it makes sense when you relate it with the clinical scenarios. So see, there is a 15-year-old lady coming to your clinic with the mother, and she had not yet started the periods. Periods have not even started, right? She described breast development at the age of 12 and pubic hair development is there. All the friends had started their periods, but she is worried. Obviously, this is how they present. She also described abdominal pain and had started a couple of years ago. Initially, she had ignored it, but now it was interfering with the sport. यानी पेन इतना बढ़ रहा है कि वो खेल भी नहीं सक रही. It was intermittent, and on questioning, she wondered if it was coming about monthly. So, scenario ये बन रहा है कि 15 साल की बच्ची क्लिनिक में आई है आपके पास, and she is complaining कि कभी menstrual bleeding हुई ही नहीं, but हर महीने पेट में दर्द जरूर होता है. So that's the kind of case which is building up, right? She had a boyfriend, but was not sexually active. Medically, there were no problems, no previous operation, no allergies. So they're giving kind of a social and behavioral history. On examination, there was normal breast development. So breast development is there, so hormones are working. Pubic hairs are there, so she's getting normal development, and the secondary sexual characters are there. There was a hard swelling in the lower abdomen. You see something, clumped up there. On observation, the genitalia, a blue swelling at the level of the hymen. Now, this is indicative. पूरी अगर हिस्ट्री को मिला के आप देखें कि 15 साल की बच्ची never had periods, but हर महीने पेट में दर्द हो रहा. So there is bleeding happening, but this is accumulating in the body. Perhaps what would be your diagnosis? I would think about imperforate hymen. Hymen does not have perforation, so the blood is accumulating inside, above the level of the hymen. So basically, that's what it is. ये हमने बात की भी थी, right? What is the treatment? What should you do? You should do surgery, make the passage so that blood comes out. Okay. Diagnosis बनाने के लिए, differential diagnosis के लिए, what would you do? You would do ultrasound, obviously. You would see कि कोई Mullerian problem तो नहीं है, double uterus या absent Mullerian structure, and then you would do and plan a surgery. That's as simple as that. Or पिछला जो blood है, you have to remove that out, and then hopefully after that things will be okay, right? Which of the following statement is true about round ligament? Choose the single best answer. SBA, single best answer. The round ligament lies posterior to the uterus. The round ligament supports the fundus of the uterus. The round ligament is vestigial, or it is non-vestigial for sure. The round ligament ends distally in the inguinal canal. If you remember, I told you this is the right answer. Okay. Which one of the following is true about the fallopian tube? It's 20 centimeter. Yeah, it's बहुत ज़्यादा हो गया. The fallopian tube has a glandular mucosa. Really? The fallopian tube is independent of hormonal influence. It is not. The fallopian tube is lined by ciliated epithelium. True, true, true. If you read the chapter, you would know that. So that is basically the end of chapter number 1. And it's a long video, but once and for all, done and dusted. We'll see you in the second chapter, which is the gynecological history, examination, and investigation. So all the very best till I see you next.